Imagine living a life where your whole family had a mental illness. Imagine having a family where everyone is fighting demons and depending on their mental strength determines if they'll survive through their struggle. According to verywellmind.com, the earliest written accounts of what is now known as depression appeared in the second millennium before Christ. In these writings, depression was discussed as a spiritual rather than a physical condition. Like other mental illnesses, it was believed to be caused by a demonic possession. As such, it was dealt with by priests rather than physicians. Depression doesn't just cause physical symptoms, it can also increase your risk or may worsen certain physical illnesses or conditions. In turn, some illnesses can also trigger depression. Depression affects much more than moods. These are a few of the most common physical symptoms of depression. Increased aches and pains, which occur in about 2 out of 3 people with depression. Chronic fatigue, increased appetite, and insomnia. Your mental health is just as important as physical health and should always be a priority. Unfortunately for some, they don't figure this out until it's too late. Now that we have discussed the history of depression, let's examine the prognosis. According to the Portal Clinic of Barcelona, the prognosis of the illness is usually very much associated with the presence of triggering factors. When the depressive disorder appears totally spontaneously, the prognosis is usually better. On the other hand, when it is associated with some precipitating event or with personality traits of the patient, it usually has a tendency towards becoming chronic. Acute complications of depressive disorder. The main complication to highlight is suicide or attempted suicide. People that suffer from a depressive disorder have a suicide risk of 30 times more than the general population. Approximately 15% of patients that suffer from a depressive disorder make at least one suicide attempt. A fast-acting depression medication could change the game. Currently, people typically have to wait about 2 to 3 weeks before seeing positive results from traditional depression medications.